For this technique, a single row repair is performed using the Genesys CrossFit suture anchor. Then, the augmentation is performed using the allopatch HD and poplok knotless suture anchors. The allopatch HD requires no rehydration and is ready to use off the shelf in minutes. First, prepare the footprint and subacromial space using a ConMed dual-purpose shaver blade and the Edge bipolar arthroscopic RF device. Then, measure the tear size from anterior to posterior and medial to lateral. Next, cut the allopatch to size, round the edges, and place 4 stick knots on the medial, anterior, and posterior locations. 2 free sutures are placed in the lateral section of the graft. To begin the repair, the Genesys CrossFit punch is inserted, followed by a Genesys CrossFit anchor. Peer-reviewed literature has shown that the Genesys CrossFit anchor has market-leading pull-out strength of 688 newtons. Next, a second anchor is inserted. The Spectrum AutoPass Suture Passer reliably passes suture in thick tissue and gives the surgeon the option of capturing the suture in the trap door or releasing the suture in the joint. After passing all 6 simple stitches, sliding knots are tied from anterior to posterior to secure the tendon to the bone. Suture tails are cut with the katana suture cutter to complete the repair. To begin the augmentation, a Spectrum 2 with Super Shuttle is used to place the 4 stitches from the allopatch HD in the anterior, medial, and posterior portions of rotator cuff. Then, the allopatch is introduced through an 8mm cannula and placed onto the rotator cuff. The 4 sutures with stick knots are tied and cut. Then a poplok punch is used to create a pilot hole for the first lateral suture. The suture tails are loaded into a 4.5 poplok anchor, and the anchor is fully seated in the pilot hole. After tensioning the suture, the anchor is deployed. This process is repeated for the second poplok anchor. The suture tails are cut and the augmentation is complete. Performing massive rotator cuff repair with the allopatch HD can potentially increase your success rate from 40% without augmentation to over 85%.